Hello everyone, welcome back. Today we are going to talk about acute versus chronic conditions. Have you ever been told you have an acute condition or a chronic one? What is the differences and why does it matter? In this video, we are going to break down acute versus chronic conditions in a simple way. Let's get started. What is an acute versus chronic disease? An acute condition is a health problem that develops suddenly and lasts a short time. These conditions usually come on fast and may require urgent care. In contrast, a chronic condition lasts a long time, often for life, and tends to develop slowly. Sometimes an acute illness can occur in people with chronic conditions. For example, someone with asthma might have an acute asthma attack. And I must say that sometimes patients who have acute condition or acute disease can progress to become a chronic disease. So let's talk about examples of each of these diseases. Examples of acute disease include malaria, diarrhea, respiratory infections like pneumonia, brain infection, which is what we call meningitis, typhoid fever, tuberculosis, a broken bone, which is what we call fracture, or migraine attack. And of course, the list is longer than this. What about chronic diseases? Example, hypertension, HIV/AIDS, sickle cell disease, chronic kidney disease, arthritis, asthma and chronic obstructive pulmonary disease, cancer like breast cancer, prostate cancer, hepatitis C and B, causing chronic viral hepatitis, mental health conditions, example like depression, schizophrenia, and lastly, tuberculosis, particularly chronic form. And of course, the list is longer than this. This is just to mention a few of them. And what are the outcomes of this acute versus chronic conditions? So for acute disease, they often get better with treatment, or sometimes even without it, and usually within days or weeks. As opposed to chronic diseases, they often last a long time, sometimes for a lifetime, and tends to develop slowly. These conditions often require ongoing management like medications, lifestyle changes, and require regular doctor visits. So I mentioned that again, require regular doctor visits and follow-up, and that's really very important. Why does it matter? Why do we have to talk about acute versus chronic disease in Nigeria? Because understanding whether a condition is acute or chronic helps to guide the right treatment plan. It helps to set expectation and also if there's need for lifestyle changes or lifestyle modification. Thanks for watching. If you found this helpful, make sure to give it a thumbs up and subscribe for more videos. And if you have any questions, please drop it in the comment section. Don't forget to like, subscribe, and share this video with your loved one. Thank you and stay connected to Nigeria no matter where you are. Bye, take care, and I will see you in the next video.